Hey guys, welcome back to my channel, The ENT Resident. Today I'll be talking about some signs that we see in ASOM and acute mastoiditis. So we have 4 signs for today. We'll talk about the cartwheel sign, we'll talk about lighthouse sign, ironed out mastoid, and the reservoir sign. So as we discuss each one of these signs, we'll talk about what kind of a sign is this. Is this a clinical sign or an audiological sign or a radiological sign? What is this sign exactly? What conditions do you see it in? What is the reason behind the sign? Why is it called so? And maybe if there are a few MCQ questions we can talk in relation to this, we'll talk about that as well. You can now purchase my notes. I have added links in the description. Okay, so let's get started with our first sign. This is the cartwheel sign. As you can see, this is a clinical sign that we are seeing on performing otoscopic examination of the ear. What is this sign? Here we are able to see that there is a congested tympanic membrane with a leash of blood vessels which are appearing along the handle of the malleus and at the periphery of the tympanic membrane. You can see this leash of blood vessels all around the periphery of the tympanic membrane, which is giving rise to the cartwheel appearance, as you can see in the second image. This is what a cartwheel looks like. If you look at our endoscopic image over here, we can see that the leash of blood vessels are giving this cartwheel appearance over here. And this is the cartwheel sign. Where do you see cartwheel sign? This is seen in acute suppurative otitis media, and more specifically, which stage do you see it in? We see it in the pre-suppuration stage of ASOM. If you want to know more about the different stages of ASOM, I have a separate video on that. You can check it out over there. Now, what is the reason behind this sign developing? Now, in the early stages of acute suppurative otitis media, in this pre-suppuration stage, there is a lot of inflammation that is happening here. Now, because of all of this inflammation, we are seeing a hyperemia of the tympanic membrane, and there is a dilatation of blood vessels as well. Because of this, the tympanic membrane appears very reddish and congested, as you can see over here. And the prominent blood vessels, they start radiating from the handle of the malleus outwards, giving this particular cartwheel appearance. And because these are radially oriented congested vessels, this is very similar to the spokes of the cartwheel that we are seeing over here. That is the reason why it is called as the cartwheel sign. Now that brings us to another sign which is related to ASOM, and this sign is known as the lighthouse sign. Now let's see what is lighthouse sign. Now we know what a lighthouse looks like, right? I do not have a video on this to show you, but I'll try to describe it best as possible. So this lighthouse sign is, again, this is a clinical sign that we are seeing during otoscopy. Now what is this sign? When you're looking into the ear, in a case of ASOM, we are seeing pus coming out under pressure through a very small pinhole perforation. Now imagine this is the tympanic membrane and there is ASOM in this case, and there is a very small pinhole perforation that has developed in this case. Now through this small pinhole perforation, we are able to see pus coming out under the pressure. Now there's a lot of pus buildup that has happened inside. Now in the middle ear as well as the mastoid maybe, and there's a lot of pus under pressure. So because there's only a very tiny perforation, we are able to see this pus coming out under pressure, and each of this is actually synchronizing with our arterial pulse, which gives this pulsating effect to the pus coming out from the middle ear. Therefore, this is also has come to be known as pulsatile otorrhea. Otorrhea meaning ear discharge and pulsatile meaning coming out in synchrony with our arterial pulsation. So this particular sign, this is known as lighthouse sign. Why is it called lighthouse sign? Because this tiny perforation is basically emitting pulsatile discharge intermittently. So it almost seems like as if it looks like a lighthouse beam that flashes intermittently. If you look at a lot of these old movies where we see a lighthouse in the middle of an island, we see that the lighthouse beam actually flashes intermittently. That's exactly what we are seeing in this ASOM case, where through this tiny perforation, pulsatile discharge is coming out intermittently. Therefore, this is known as the lighthouse sign. Now, where do we see this sign in? We see this sign in first case is ASOM. Now, in ASOM, which stage do we see in? We saw that cartwheel sign is a sign of the pre-suppuration stage, whereas lighthouse sign is seen in this transitory phase when the ASOM disease is proceeding from the stage of suppuration to a stage of early resolution. We know that in a stage of resolution, the tympanic membrane perforation has happened, and all of the pus and the pressure, which was built under pressure, all of it comes out. So when in this transitory phase from suppuration moving on to the early resolution phase is when the tympanic membrane perforates, and at that time is when we see the lighthouse sign. The second condition where we can see the lighthouse sign is in case of acute mastoiditis. So these are the two conditions where we see lighthouse sign in. Now let's try to understand what is the reason behind it happening here. Now in both of these cases, pus collects inside the mastoid and the middle ear. Now this pus starts coming out under pressure through this pinhole perforation. Now because of the vascular pulsations within the middle ear itself, the discharge starts to appear pulsatile. And because it is appearing pulsatile and this discharge, it starts reflecting the light intermittently as it comes out. So it almost looks like this lighthouse beam. And that's why this is known as the lighthouse sign. Next, moving on to our third sign, which is the ironed out appearance of the mastoid. Now, this itself again is a clinical sign that we are seeing when we are examining the mastoid. What is it exactly? How do we describe it? As you can see in the image, the mastoid actually appears, there's a smooth, shiny, flattened appearance of the skin over the mastoid region. It looks as if the mastoid area has been flattened out because the normal bony contour is lost. If you try to touch your own mastoid, which is I am hoping is a normal mastoid, you'll feel this very pitted sensation as you try to touch it. It does not feel as smooth as these images are showing you the mastoid to be. Now, because this normal pitted appearance is lost, it almost looks like as if the mastoid has been ironed flat. And that is the reason this name ironed out appearance came in. Now, this is a sign that we see in cases of acute mastoiditis. What is happening here? So the infection usually starts from the middle ear and then it spreads to involve the mastoid air cells. And once over here, it breaks through the mastoid cortex. The pus breaks through the mastoid cortex and it leads to the development of periostitis. And there is a subperiosteal pus collection that happens over here. Over time, this leads to a thickened periosteum. And the skin that overlies the mastoid starts becoming stretched out, shiny and swollen. And that's what leads to this typical appearance of the ironed out mastoid. And so here basically if you have ever ironed your own clothes, you'll see how the clothes appear very flat, smooth and polished after you iron it. Because this ironed out this mastoid looks very similar to that's the reason why it came to be known as the ironed out appearance of the mastoid. Now, as we are discussing it, just a small question along with it is, what are some other signs that you are seeing in acute mastoiditis? So we have already spoken about lighthouse sign. We have spoken about the ironed out appearance. The third sign that we'll talk about is the reservoir sign. But before we talk about the reservoir sign, some other things that you can observe on an otoscopy is that the not an otoscopy, an examination of the ear, you'll see that the retroauricular sulcus, this is the retroauricular sulcus. You can see how this retroauricular sulcus gets obliterated in acute mastoiditis. So that is one typical sign that you see. And other than that, when you see inside the ear on otoscopy, you'll be seeing that there is posterior-superior meatal wall sagging. That is also a typical feature that you will be seeing in case of acute mastoiditis. Okay, last of all, let's talk about what is reservoir sign. Now, reservoir sign is again another clinical sign that you see during ear examination on otoscopy. What happens here? What happens here is when you're seeing you'll see that there is pus or discharge in the ear. Now you try to suction it out, clear this discharge. The moment you try to suction and clear out this pus or discharge coming, you see that it is immediately getting refilled. So the external auditory canal keeps getting refilled with the pus as soon as you clear it off. This is known as reservoir sign and it is typically seen in acute mastoiditis. Now what is happening here? As I've mentioned before, in acute mastoiditis we have pus accumulation in the mastoid as well as the middle ear. Right? Now, when we are clearing it, we are trying to suction out all of this pus. But the moment we have cleared out whatever pus we are seeing in the external auditory canal, it suddenly starts getting filled within minutes. This is because there is a continuous pus production happening inside the mastoid or the middle ear. So what we are cleaning, we are not able to keep up with the pus production that is happening. That is why every moment we clean it, it suddenly starts appearing again because it's continuously draining out into the external auditory canal. This sign is called the reservoir sign because the mastoid or the middle ear rather, both of them, they are kind of acting like a reservoir of pus. That even after keeping on cleaning, the discharge keeps on spilling into the external auditory canal and refilling it. And this is the reason why it is known as the reservoir sign. So that's all about the different signs that we see in case of ASOM as well as acute mastoiditis. If you have any further questions on this, please note them down in the comment section and I'll get back to you. Thank you.